Hello everyone, welcome to today's show. My name is Spencer Walsh. We have a good one for you today as always. Today we're going to talk about some of the latest updates with the coronavirus, including a very disturbing quote from Bill de Blasio saying, quote, "This coming Sunday is D-Day. If critical supplies do not arrive soon, thousands of people will die." He said, we'll take a look at why that is and keep you posted on all the latest. Also, an interesting and very telling exchange on Twitter that talks a lot about, I think really represents a lot about the fights that we have to take on, coronavirus or no coronavirus. We react to other people's reactions, and also I give my reaction that unemployment is so high. It's not like we have a massive recession or anything, though, according to our president. This is unacceptable. Some people are saying about Trump administration now saying people may have to wait 5 months to receive a $1,200 relief check for one time. Like, thanks. Really appreciate that. And also, yeah, they're thinking about holding the Wisconsin primary next week. Stay tuned, because I may be liable to go on a little bit of a rant with that one. Yeah. As people, the last primary that they held a primary during this whole coronavirus craziness about 2 weeks ago, and people from those places are now starting to get sick. That's what we're dealing with here. And of course, we do have a special announcement in the middle and at the end of the show, and something that will be good, folks. So stick around for that, please. Thank you. So without further ado, today we start at the top of what is going on and talking about the coronavirus and the live updates coming in today. The guidance on masks, interestingly now, has been reversed. For months, health officials have been walking on an awkward line when it comes to masks, saying that they offered little or no protection to the public and should be reserved for healthcare workers because there's not a lot of masks left. But the contradiction seems close to resolution. Now, the White House, while stopping short of declaring an official policy, joined the mayors of Los Angeles and New York and several European nations and much of Asia in recommending that people wear cloth face masks in public, even if they have no symptoms. This may help stop people from transmitting the coronavirus, but social distancing remains the best way to slow the spread, health officials say. So, if you do have to go out, make a little bit of a cloth mask, maybe to cover your face, and just keep the germs really away from your face. That's the most important thing. So if you're going out, you're touching things, maybe you don't have gloves, like that would be a very, very effective way to not have the germs come into your face, and the virus get in, because that is really the the biggest hole, the biggest weakness in your defenses is all up in that head area with the ears, the nose, the mouth, like all those areas. But it could get in, I guess, through your skin, and gloves are also very effective. But if you are able to get a mask, get some gloves, it's very much worth it if you have to go outside. But in the end, social distancing is still the best way. Yeah, so some U.S. states, though, they're still resisting such measures. But Dr. Anthony Fauci, the nation's leading infectious diseases expert, said that he believed a nationwide lockdown order made sense. The tension between federally mandated versus states' rights to do what they want is something I don't want to get into. I don't blame him for that. It's probably activates a whole lunatic. You really press the lunatic button. I think when it comes to that, he said. But if you look at what's going on in this country, I don't understand why we're not doing that in reference to a national lockdown. So the lockdowns have led to a collapse in the global economy, vaporizing 10 million jobs in the United States in just 2 weeks. Global stocks, which has surged on Thursday after a wishful tweet from President Trump about the oil markets, dipped again on Friday amid growing fears the pain will be profound and prolonged, while U.S. equity futures pointed lower. Governments have promised trillions of dollars in a desperate effort to limit the damage, and none of that has stopped the virus's ferocious global assault. At least 1 million infections have been detected worldwide, but experts suspect the true number is far larger because of asymptomatic cases and delays in widespread testing, and the idea that maybe it even spread to America before we even got a handle on it and hit people hard. We don't even know about it. We thought maybe they just died of the flu or something like that. You never really know. So the Australian medical chief estimated there are between 5 million and 10 million cases. This is worldwide. And Beijing and Washington did declare a detente in their sniping. It emerged. The CIA had been warning the White House since last February that China was vastly underestimating the scale of the crisis, limiting the usefulness of its data in predictive models. Model makers are now being guided by other grim data, most of it now coming from Europe. There's widespread belief, at least among the intelligence community, and of course, you can always take that with a grain of salt, but I mean, I'm more inclined to believe this than not to believe this, that China is pushing their numbers lower because they've been caught doing that, and they can. Like, they're the one of the few entities, really, with no limits on what they can do, or at least governmental entities. So, yeah, really, it's the staggering death tolls in Italy and Spain, accounting for nearly half of the 53,000 deaths worldwide, rose yet again. But the crisis is deepening across the continent, with more than 5,000 deaths in France, nearly 3,000 in Britain, and more than 1,000 in both Germany and Belgium. The number of recorded deaths in the United States topped 1,000 in a single day for the first time recently. In New York City, the center of the country's outbreak, both hospitals and morgues struggled to meet surging demand. So that's when you know it's really trouble. When we get to Italy territory and we have to start putting dead people in churches because the morgues are too big, or too small. Governor Cuomo warned on Thursday that time was running out to find critical supplies, including the ventilators needed to sustain the most critically ill patients. If a person comes in and needs a ventilator, you don't have a ventilator, the person dies, Cuomo said, as Daily Briefing in Albany. That's the blunt equation here, and right now we have a burn rate that would suggest that we have about 6 days in the stockpile. So we need like some massive, heroic delivery of ventilators and masks and PPE and the key stuff. And apparently, according to de Blasio, the do or die time is this coming Sunday, and if not, massive people will die. Like, that is a crazy situation. Like, just to think about that, the level that we could be in New York very soon is very, very disturbing. So, yeah, let's see what Britain's doing to try to get people back to work here. It's drawing up plans to issue an immunity passport for key workers that would certify they have already recovered from the coronavirus and carry antibodies identifiable by a blood test that would allow them to resume a normal working life. Although in its early stages, the idea could form part of a broader exit strategy from the countrywide lockdown once the spread of the disease has been brought under control. We have a stream of work underway on immunity, Health Secretary Matthew Hancock said on BBC on Friday. We are potentially having immunity certificates so that people which have been through it, and when the science is clear about the point at which they are then immune, people can then start going back to normal. Which definitely sounds like it makes sense. But we do have to be very, very careful. Once you get those antibodies in, how long are you immune for? Because it's not like you're going to be immune forever. You could, but we just don't know that yet, I don't think. So, so the government says that it's working to ensure that such tests are sufficiently accurate, but that are not all performing to required standards of reliability. So they need to be absolutely sure. Prince Charles, the heir to the British throne, opened up the country's newest and largest hospital on Friday with a capacity for 4,000 beds. The temporary facility is called the NHS Nightingale, and just an exhibition center in East London was converted in just 9 days. Meanwhile, literally that big amazing ship that came in to New York City at the beginning of this week, right now apparently only has 20 patients in it out of a 1,000 that it can hold, for some 15 or 20 patients in it. It's absolutely insane. This is just really some pretty. I'll give you the details here because it's really incredible stuff. The big comfort ship that came in to the roaring soundtrack of aid and support. It was incredible to see this this brave USS Comfort coming in with the big crosses coming to New York Harbor with the ships around it. So this was the New York Times. Such were the expectations for the Navy hospital ship USNS Comfort that when it charged into the New York Harbor this week, throngs of people momentarily forgetting strictures of social distancing crammed together into Manhattan's west side to catch a glimpse. Because it was an objectively impressive sight. Like, you got all the people, all the big, the harbor ships, and then all the police escorts, and then the big, impressive ship. It was, oh, wow. But I mean, it's kind of stupid, though. I mean, to go out there and watch a ship come in, like you trying to stay alive here. I mean, Jesus Christ. So the ship's 1,000 beds, though, are largely unused, and its 1,200 member crew is mostly idle at this moment. This is, again, like 4 days after they brought it in. It arrived on Monday. If I'm blunt about it, it's a joke, said Michael Dowling, the head of Northwell Health, New York's largest hospital system. Everyone can say, thank you for putting up these wonderful places and opening up these cavernous halls, but we're in a crisis here. We're in a battlefield. People need those hospital beds. People need to stop the overcrowding, the overcapacitation of these hospitals. And if they can't really do that, they have the opportunities that are available. It really is. It's crazy. President Trump left a 9-day sequester in the White House last week to travel from Norfolk, Virginia, to personally see off a ship that, as it set sail for New York, saying it will play a critical role. The ship's arrival on Monday was cheered as one of the few bright moments in a grim time for the city. The reality has been different. A tangle of military protocols and bureaucratic hurdles has prevented the Comfort from accepting many patients at all. On top of its strict rules preventing people infected with the virus from coming on board. What? Isn't that what it's supposed to be for? No, I do believe they're trying to treat patients that are non-virus related. What they're trying to do is they're just trying to say the hospitals take the coronavirus patients and we take quote-unquote everyone else. But there's a problem with that because the Navy is also refusing to treat a host of other conditions. Guidelines disseminated to hospitals, including a list of 49 medical conditions that would exclude a patient from admittance to the ship. Ambulances cannot take patients directly to the Comfort. They must first deliver medical patients to a city hospital for a lengthy evaluation, including a test for the virus, and then pick them up again and transport them to the ship. So, yeah, that's the kind of standard here the Navy is setting. So that's kind of why there are no patients in there right now. There's 20 patients right now as of yesterday. So hopefully it's more, but we are not sure. So, in cities across America, while many low-income workers continue to move around, while those who make more money are staying home and limiting their exposure to the coronavirus, according to smartphone location data analyzed by the New York Times. Although people in all income groups are moving less than they did before the crisis, wealthier people are staying home the most, especially during the work week. Not only that, but nearly in every state, they began doing so days before the poor, giving them a head start on social distancing as the virus spread, according to aggregated data from the location and analysis company Cubix, which tracks about 15 million cell phone users nationwide daily. So it really is a pretty incredible picture. Staying at home during the coronavirus, it's proven to be a luxury, and the fact that a lot of these there's two lines. There's the racial and the class line to this, because a lot of those incomes, a lot of those people living in those areas that are most hard hit by the coronavirus are working class people of color to a very large degree. And it shows you that's something that we really got to acknowledge about this crisis. And if you really want to help, if you really want to make a difference, especially in spreading the virus, even if you actually do it with the intention to help everybody, you are helping so many people by keeping and giving the working class and especially the working class of color, and by helping them stay home, it is absolutely huge. So, if you look at it, when people started isolating, I think really plays a big role in this. So if I just scroll back here to March on the calendar, so we have a really